Well, thank you, Mr. Chairman. I thank in advance the witnesses for taking the time to be here today. Um, when I first heard that my Republican friends were holding a hearing on health care, I replied, no, really, what's the subject of the hearing? Because I was shocked. This is the crowd that just passed a bill to take away health care from more than 15 million Americans. And now they want to have a hearing. Geez, we should talk about the problems in health care. Do you remember something called the Big Beautiful Bill? We have a president who gave it that absurd name, kept talking about it, kept bragging about his so-called Big Beautiful Bill. Well, beauty is really in the eye of the beholder. It was a beautiful bill if you're a billionaire, if you're in the top 1%. $5.3 trillion worth of tax cuts, mostly going to the richest Americans. How is it paid for? The largest healthcare cuts in American history. Approximately $1 trillion of healthcare cut in the Big Beautiful Bill. Most of those cuts are to the Medicaid program. About 10 million Americans currently on Medicaid will lose their health care beginning December 1st of this year when those cuts kick in. Another 5 million Americans who currently have their health care through an Obamacare exchange will also lose it because of those cuts that have now begun to take effect. In total, more than 15 million Americans will lose their health care as a result of the Trump Republican Big Beautiful Bill. And as draconian as those health care cuts are, they still don't even pay for all or even a majority of the tax cuts. The rest, debt spending. The bill that was passed by the Republican majority last year, the single biggest increase in debt in American history. Then they have the nerve to turn around and say, my God, we have a debt problem. We should probably do something about it. Give me a break. But back to the 15 million Americans who are going to lose their health care as a result of their bill, I want to be clear. That's not my number. That's not from any Democratic source or Democrat source, as the folks on the other side constantly label us. That's from the official projection of the Congressional Budget Office, the CBO. So there is no dispute whatsoever that millions and millions of Americans are about to lose their health care. Millions more will be paying more. The average increase coming from the Commonwealth of Pennsylvania, the average increase for those on the Obamacare exchange in my state, 102%. So overnight, a family that was paying $700 a month, now paying $1,400. For some, that just becomes unsustainable and unaffordable, and so they drop coverage altogether. Now you might think, well, I'm not on Medicaid, I'm not on Medicare, I'm not on Obamacare. Those cuts don't affect me. Some 170 million or so get their health insurance through an employer-provided plan. They might think that they're fine. Next time you go to the ER and there are people ahead of you who are in that ER because they don't have health care and they don't go to a primary care physician, so they got really sick and are now showing up at the ER, that's impacting you. The health system in your area, especially if you're in a rural area, that is cutting back on services in order to absorb these cuts, that's affecting your health care. Make no mistake about it. Every single American family will be hurt as a result of the greatest health care cuts in American history. Not even during the Great Depression did 15 million Americans lose their health care coverage. But thanks to President Trump and this Republican majority, they're about to make history with that number of Americans losing it. I'll wrap up with this, or at least wrap up for now. Donald Trump, after being on the political scene for 10 years, has a great health care plan. Maybe you've seen it. Last year, he talked about concepts of a plan. Now he has a great health care plan. Just don't get sick. Problem solved. Tax cuts for the rich, health care cuts for everyone else. Mr. President, how about instead of giving the American people Greenland, we give them health care? With that, I yield back.